Education Department at Mount Sinai South Nassau, and I'm located here at the JCC in Oceanside. So today we have with us Dr. Aaron Glatt, the chair of the Department of Medicine and the chief of infectious diseases at Mount Sinai South Nassau. And today we're going to discuss COVID-19 and the flu, how to stay healthy during the holidays and winter months. So we'd like to thank and welcome Dr. Glatt.
Thank you very much for having me. Can everybody hear me okay?
Yep. Yeah.
Okay. So what I'll ask people to do is put themselves on mute, which I see most of you are, and I will be happy to take some questions. I would be more interested in answering your questions than I am in giving a lecture, but I will try to fill you in on the quote potential for this twin-demic, as we call it, between flu and COVID-19, and to give you a lot of exciting news. I want to go over some very, very, very important things that I hope and assume that most people are already familiar with in terms of keeping yourselves healthy. I'm just looking around the room. I see it's mostly all very, very young people, but I'll talk for this as if there were some older people on as well. It's critically important for everyone to realize that we control to a certain extent whether we're going to get COVID-19 or not. And similarly with the flu, we control whether we're going to get the flu or not to a certain extent. Now, this year more than ever. In the past, I wouldn't be able to say to people, you can control whether you can get flu or not, because people weren't masking, people weren't social distancing, people would go to work when they're sick because I'm needed, I'm an essential worker. And even if you got vaccinated, the vaccine for flu is not perfect, although I strongly suggest that everybody get vaccinated if they're able to, which is for the vast majority of people, they can get flu vaccinated. And I hope and assume that all of the people here listening are already vaccinated against the flu. I certainly am, and I'm always one of the first people to do so. It's critically important to do that. This year, we will probably, hopefully, see a lot less flu because of masking and social distancing. I hope everybody knows what I mean by masking and social distancing. Masking is the wearing of a mask, a typical surgical mask like this, but even a cloth mask, a 3-ply cloth mask is probably just as good as a surgical mask, or they're roughly the same. And you wear them, I want to, again, show and tell here, you want to make sure you're wearing it over your mouth and over your nose. Wearing it like this, not very good. Wearing it like this, it's a pretty necktie scarf, but it doesn't do anything. And you really want to cover up the mouth and the nose, because in this way, you are protecting yourself and everybody else. The CDC has finally come out with a statement, which I think we've all felt comfortable saying for a long time, that if you're wearing a mask, you're less likely to get sick yourself, but more importantly, you're less likely to get other people sick. You can transmit COVID-19, this novel coronavirus, even if you have no symptoms whatsoever. You can transmit flu if you're mildly symptomatic, and probably if you're asymptomatic as well, but more people with flu are going to have symptoms. Whereas COVID-19, especially if you're younger, and we'll define younger here, certainly in the kids under 10, they're probably half of them have no symptoms whatsoever, and the other half have a runny nose, and kids always have a runny nose. So, that's not much of a way to tell that they have COVID. Kids between 10 and 20, very high percentage of them, probably 30, 40% have no symptoms. Kids between 20 and 60, so a significant percentage of them don't have symptoms, 20%. And even kids above the age of 60. So there are more likely going to be symptoms, but sometimes they're pretty mild symptoms. We've had patients at the hospital come into the hospital 100 years old, and they had mild symptoms, and they didn't get really very sick at all from COVID. Unfortunately, that group of patients above the age of 60, then above the age of 70, and then above the age of 80, as you hit those wonderful milestones, which we all look forward to hitting, and then even 90 and 100, so then you are more likely to get symptoms and more likely to get sick from COVID-19. And that's why it's especially important for older people, and I won't define that. It's about 20, 30 years older than me. That's how I define old. And if you're in that age group, or even close to me, or even younger than me, you should be wearing a mask at all times when you're around other people outside your family. That means if you're at work, you're in the library, you're at the JCC, wherever you are, you should be wearing a mask. If you're around people that aren't in your family, aren't in what I call your bubble, in your group of people. And that could include kids. I'm not in the same bubble with all of my kids and all of my grandchildren. So when I'm around them, as hard as it is, I wear a mask. And I do cheat and I hug some of my little grandchildren a little bit, but not for very long. And I try not to be directly within 6 feet of them for an excessive period of time. And I do it outside. I was outside with a bunch of my grandchildren yesterday. And that's much safer than being inside in the house, especially when they're younger kids and we don't expect them to wear a mask. My older grandchildren, when they're around me, they wear a mask already. And we still try not to be very close to each other. And we try to be outside where it's possible. Until about now, outside has been a great option. God's been very good to us and has given us beautiful weather. Let's hope it continues through Thanksgiving. I know people have plans for Thanksgiving, and it could be a very wonderful time. It could be, heaven forbid, a dangerous time. So therefore, it's important that people take the appropriate precautions. Outdoors, in general, is safer than indoors. As it gets colder, outdoors isn't an option, especially for people that can't tolerate the cold. That's why God created Florida, so people can go to warmer weather. Um, I love New York in the cold. I happen to like cold weather. So everybody's different. For people that can tolerate the cold, that can go outside, great, do that. It's much safer. If you're interacting with other people like your children, grandchildren, great grandchildren, that's a great way to interact with them more safely. But even there, wear a mask. And even there, distance. Distancing is your best friend. The further you're away from somebody, the much less likely you are to get COVID. So this is critically important because COVID is out there. People don't realize how much COVID is out there. The United States right now has more COVID right now than we had back in April and May. Everybody remember what April and May were? They were horrible times. Our hospital was overwhelmed. We came close, very close to collapsing under the weight of COVID. We have phenomenal people at Mount Sinai South Nassau, and they did such yeoman's work. And we were able to have at one point over 400 patients in the hospital who had COVID. The hospital normally doesn't have a census of 400 people. We had additional 100 patients besides COVID. So at one point, in our highest census, we were over 500 patients in the hospital, 400 of whom had COVID. And those patients are very sick. It was almost like having a 400-bed ICU. Our normal ICU bed is 30 beds. And it was like we had 400 ICU beds. And that was a very, very dangerous time for our staff, for our patients, for the community. And thank God to the staff at the hospital and at all the other hospitals. And not just Mount Sinai South Nassau. Of course, I know that personally. But I have friends at other hospitals, and they all did yeoman's work, and they all deserve tremendous congratulations. But we don't ever want to be in that situation again. And we're seeing an increase. We're seeing the numbers going up. And in the community testing that we do, we've seen our rates go up in the last month from 1% to 2% to yesterday we were at 8%. So the numbers are going up. We've seen our census in the hospital go from 1 to 2 over the summer, only 1 to 2 patients. For one 15-minute period of time, we had 0 COVID patients in the hospital on one day in the summer. And then a patient came in right when we discharged our last COVID patient. 15 minutes later, another COVID patient came in. So we were COVID free for 15 minutes this summer. And we're running a census of 1 to 2 patients. And now, unfortunately, we're over 20 patients again. And we have patients on ventilators in the ICU who have COVID. And this is scary. There are parts of the country right now, El Paso, for example, other places that are overwhelmed. There are parts of the country where they're really not able to provide the care that everybody would expect for their heart attack victims, for their stroke victims, for the kids with asthma, because they're so overwhelmed taking care of patients with COVID. We stopped all elective procedures, all elective surgeries, elective colonoscopies, any elective procedures. We stopped for 3 or 4 months during April, May, June. We only started bringing them back in July, and it's safe to go back to them. We take pride in terms of all the precautions we put into place. But if the COVID numbers go up, we're going to have to stop that again. And that's bad news for everybody to get their normal routine health care needs taken care of. In the summer, if somebody was expected to have a hip replacement because they're a teacher and, they do their medical things like that in the summer so they won't impact their job. Well, guess what? They didn't have the hip replacement this past summer because we weren't doing elective hip replacements for most of the summer. Only in August did we start doing that. So this is a real problem from the country's healthcare point of view. So the most important things that everybody can do is to make sure that you mask and that you social distance, indoors and outdoors. Outdoors is always safer than indoors, again, temperature dependent. If you're going down to Florida, if you're going to a warmer place, then stay outside. It is much safer. Socialize with your friends at a distance. I was telling people, for those Labor Day weekend barbecues, outdoors, 8-10 feet away from each other, that's an acceptable way to have a dinner together. For Thanksgiving, if God is nice to us and makes the weather warmer, have lunch outdoors. If the temperature is 50, 60 degrees, that's safer than going indoors for supper when it's too cold, maybe outdoors. And you can get together with your family outdoors rather than a more dangerous indoors. So these are very important. When you're eating, you're not wearing a mask. So when you want to get together with people, ask yourself, how essential is that food to the social nature that you want to have? We're all social animals. We like to get together with people, but maybe we don't need to do it with cake as much as I like cake. Maybe we need to have some socializing, playing cards with your friends, but you don't have to have the cake. You don't have to have the meal so everybody can wear their mask. Maybe we don't need to be right on top of each other. We can spread out a little bit and move back and have people in a more distanced, even if it's indoors, more distanced. And maybe we don't need to have every single friend that we know come to every single meeting and social event that we have. Maybe we need to limit it to 2 or 3 friends. Maybe if you're playing bridge or you're playing some other game, it's only those people there. Don't have other people around, and have the people spread out. Maybe we need to have Zoom games and Zoom conversations a little bit more. The technology is phenomenal. I can play with my grandchildren checkers or various match games through technology. We can see each other. We can play the game. It's safer for me. And that's the ultimate thing that we all want. We want to be with our grandchildren next year. We want to be with our grandchildren 5 years from now. And in order to do that, we have to be as safe as possible. Same thing applies with influenza, although we never really did as much as we're doing now for COVID in terms of influenza. Does anybody know how much influenza they saw in Australia this past year? Well, I'll tell you. They saw less than 1% of the influenza that they saw in the previous years. So they had normally tens of thousands, if not hundreds of thousands of cases of influenza in the city. Now they're seeing 5 or 10 cases. We saw a dramatic drop in influenza this past year in March, April, and May, when we still have influenza here. We saw almost no positive influenzas once people started masking and social distancing because of the COVID craze. So it has a benefit. I call it the one silver lining in this horrible pandemic, is that we probably have far less deaths from influenza this past year than we have ever had. And I'm hopeful that as people take the vaccine and people mask and socially distance this year, now during the start of influenza season, we will see what Australia saw. We'll see what Brazil has seen. Very little influenza. Now, influenza kills tens of thousands of patients every year. It's estimated last year that there were 40, 50,000 deaths due to influenza. So it's not a mild disease in many people, especially as you get older, especially as you have underlying lung problems or heart problems. Influenza can be a fatal illness. Influenza can kill mommies who are pregnant. Influenza can kill some kids, unfortunately. It's a horrible disease. It's nowhere near as bad as COVID, but it's a horrible disease. And therefore, I think one of the best benefits, the only benefit maybe of COVID pandemic, is that we'll see less influenza. I want to talk a little bit optimism, and then I'll take some questions. Everybody hopefully has been hearing about the wonderful vaccine news that is hopefully coming our way very, very soon. And there are 2 companies, Moderna and Pfizer, that have come out with their preliminary data, which show unbelievably positive news about how those COVID vaccines are. Now, this is a new technology. Both of these companies, I won't get too technical, but they have a new technology called mRNA vaccines that are not yet experienced. We've never had these vaccines, but they look extremely promising. And that's why they've come forward so fast. They're actually easier to make. We think that they're perfectly safe. The data so far shows that they're very safe. The difference between the people who got the sugar water and those that got the vaccine in the studies, and we have probably about 50,000, 60,000 patients who've gotten the vaccine already, both the two different vaccines, no difference in toxicity, no difference in side effects versus the people that got sugar water, a little shot in their arm of sugar water. So that's very reassuring. It's not perfect. I'd like to see hundreds of thousands of people. I'd like to see tens of millions of people getting the vaccine and know that it didn't cause any rare and unusual complications. But when you consider that COVID has a mortality rate that is very high, if you look at different populations, in the older population, it has a very high mortality rate. You know, you're dealing with sometimes a 12 to 15% mortality rate in the older population. So it's a serious illness. Baruch, you know, thank God it's much better today than it was in March and April. We have better treatments, we have better understanding. So it's actually a better outcome likelihood. Even if you get the illness and you're older, your outcome is far likely to be better now than it was in March and April. But at the same time, if we can prevent people from getting the illness, that's so much better. And this vaccine is going to hopefully be actually rolled out and given to doctors like myself and other healthcare workers in December. We're very hopeful we'll still get it in 2020. Within the next few weeks, we're already preparing how to go and give this to our staff and then to first responders and to people at the highest risk, which would include people with underlying medical problems and people of a certain age. Now, I don't have all the details on that yet, but it's very, very exciting because the people that are most at risk of getting COVID are potentially going to be the ones that will get this vaccine first. And if it's anywhere near as good as it's touted, in the Moderna vaccine data that came out today, they had the two arms of the vaccine. You had the group that got the vaccine, then you got the group that didn't get the vaccine. So in the group that did not get the vaccine, 20,000 people, they had 95 cases of COVID occurring in that group. In the group that got the vaccine, they had 5 cases of COVID. 90 versus 5. That means it's like 95% protective in terms of getting COVID. If I could have a guarantee that I'm 95% less likely to get COVID, wow, that's phenomenal. That's a great vaccine. And if you tell me that it's just as safe as taking no vaccine, as taking a sugar water injection in your arm, that's even better. So this is something that I think is extremely exciting. And the data for the Pfizer vaccine was the same. The data for this Moderna vaccine is the same. Russia came out with their Sputnik 5 vaccine data, which is roughly the same. And I know China has been developing their vaccine. So the more vaccines, the merrier. We don't want the Chinese vaccine to fail. We don't want the Russian vaccine to fail. We want them to have a very successful vaccine so they can vaccinate all the people in their country. Forget life. Of course, that's the most important thing. We don't want anybody to die. But we also want everybody to get vaccinated. This way we can end this pandemic. And it will take a while till we get everybody vaccinated. But we're planning on vaccinating the highest risk people first, which is, I think, a great opportunity for us to go and maintain good health in the people that are most likely to, unfortunately, get into trouble with COVID. So this is the most exciting news about this vaccine. The second thing I want to talk about is that there are other vaccines coming down the line too. There's 2 other vaccines that are almost near completion of their first analysis of their phase 3 trials, which means that a lot of people, 20, 30, 40,000 people getting the vaccine and getting the placebo, getting the sugar water. And their preliminary data will be available probably within the next month. 2 additional vaccines, one from J&J and one from AstraZeneca. And there are other vaccines coming down the line as well. So I think that in early 2021, we're going to have many different options, hopefully. Please God, we'll have many different options available for us to go and offer to patients. And which one would be better? I have no idea at this point in time. I think that they'll only get approved if they're all shown to be safe and effective. So at this point, I would say whichever one gets that approval would be the one that I would roll up my sleeve to take right away. And that's what I would recommend to other people as well if they fall into the higher risk categories. The last thing I want to talk about is that we now have some therapies to go and treat COVID as well, which we didn't have previously. So we know that giving steroids, something called Decadron, but other steroids as well, can be very effective in helping prevent some of the serious complications of patients who have severe COVID pneumonia. And we have been using steroids now for several months, well, actually almost since the beginning of the epidemic. And there are data to support that they're effective in preventing some of the very serious complications. But if you're able to be an outpatient, if you don't need to be in the hospital, then you should not be taking steroids. It doesn't help in that group. It really only helps in the sickest of patients, and it should be only used in the sickest of patients. There's a drug, it's called an antiviral. It goes against the virus called remdesivir. Remdesivir has been shown to be a benefit in decreasing some of the serious complications and hospitalizations of patients with COVID-19. So that's another new treatment that we have that's now been officially FDA approved. And we've been using it regularly, and it definitely is of help. There are some other therapies as well, which I won't talk about, except the last one is a brand new therapy that just got last week approval from the FDA for what we call emergency use authorization, which means that it's able to now be given. It's not approved, but it's able to be given to prevent serious complications of COVID in relatively healthy people, people who just got diagnosed with COVID and are beginning to have symptoms. And we're hopeful to be starting to use this drug this week. We're expecting a shipment tomorrow, and this drug will be available in very small quantities, and it's only indicated for a very specific group of patients at this point in time who are at the highest risk for getting complications and are early on. They're still healthy enough that they don't need to be in the hospital, and it's within a couple of days of the onset of their illness. And the hope is that this drug, don't try to remember the name, bamlanivimab, bamlanivimab, bamlanivimab. Try to say that 3 times fast. But I want to propose that the only people that can get it are the people that can say its name. So it's a monoclonal antibody, which is a new type of treatment as well, specific for COVID. And this is the one that Governor Christie took. And he did very well. And there are data. There's a published paper to suggest that patients do much better who take this treatment, and they have much less likelihood of getting hospitalized, and they do better. So this is a brand new treatment that is only going to be starting to become available later this week. And we're hopeful that it will help also save precious lives. And that's the bottom line. We're beginning to see the light at the end of the tunnel. I'm very optimistic, as I'm scared at the same time, because we're getting back to numbers that we've not seen for several months. And if everybody in the winter starts to go indoors and expects their lives to just be like they were last year, lots of socializing, indoor parties for Thanksgiving and for the holidays and for, all sorts of family gatherings, so then we're going to have problems. So I think we need to be a little bit careful still, and we can't let this pandemic fatigue set in, and that we really need to go and hold out a little bit longer, because I do see the light at the end of the tunnel. And please God, we hopefully will see a successful vaccines available to be rolled out across the country. There will be enough doses within the early part of 2021. I'm hopeful that anybody that wants to get vaccinated will be able to get vaccinated. And when you couple that with some of the better treatments that we have, and you couple that with people still masking and social distancing, maybe we will finally win the war against COVID. So I thank you very, very much for listening, and I'll be happy to take some questions at this point in time. I don't know how you want to do this, Lisa, Val. Do you want to, how do you want to open this up?
Okay, well, Helen has her hand up. Helen, just unmute yourself.
Yeah, I'd like to know if, let's say, a certain number of people want to take the vaccine and take it, and there are other people who do not wish to take the vaccine. Suppose they don't take it. Will the people who took the vaccine be protected or not? And how would you convince the other people to take the vaccine?
Good question.
Those are very good questions. So if the vaccine is effective for somebody, it will protect you. Now, none of the vaccines are perfect. Almost no vaccine is perfect. But vaccines work much better by helping to make most of the community not able to get the illness. And then there's a protection, what we call herd immunity, which means that if I have in a room 100 people and 95% of them are protected, the other 5 that didn't take the vaccine will probably be protected as well because there's nobody in the room that has the illness. And even if there's one person in the room that has the illness, the chances of them coming into contact with the other 5 people that are exposed or potentially able to be exposed is lower. So in answer to your question, ma'am, if you take the vaccine and it works for you, you'll be protected. You want to also protect maybe your spouse or a friend that can't take the vaccine for whatever the reason or has refused to take the vaccine. So the more people that are protected, the less likely they'll get sick as well. But somebody who doesn't take the vaccine, they're absolutely fully at risk if they come into contact with somebody who has COVID of getting COVID and heaven forbid, getting very seriously ill and even heaven forbid, dying from it. So my advice to anybody is that unless you've had COVID right now, and if you've had COVID, we don't know yet, should you or should you not take the vaccine? You haven't had COVID, you absolutely, if you're in a high-risk group, should be running once the vaccine is available to take it. I haven't had COVID. I will be running to take the vaccine as soon as it becomes available because I want to protect me. I want to protect my wonderful wife. I want to protect my patients. I want to protect my community. So that's another great reason to take the vaccine.
Joan?
Yeah, I haven't taken a COVID test. Would you advise everyone to take one or just?
No, it's a
Okay.
very good question. I do not advise people to take COVID tests if they have no symptoms and have not been exposed to somebody, because the chances are, if you've been careful, haven't been exposed to somebody with COVID, and you limit who you're exposing yourself to, it's going to be negative. So why take a test that you know it's going to be negative? And some of the tests out there in a very, what we call a very low risk setting, are actually going to give you a positive sometimes. That's what we call a false positive. The tests aren't perfect. So if somebody has symptoms of COVID and they've been exposed to somebody with COVID, if they test positive, it's a real positive. But if somebody's living in Antarctica and there's nobody in Antarctica right now that has COVID, and I tested everybody in Antarctica with a less than perfect test, it's possible that 1 or 2 of them will be positive, but they don't have COVID. So the test isn't perfect, but it's a very good test. And if it's used appropriately, and appropriately means to me, people who have symptoms, they should get tested for COVID. People who've been exposed to somebody with COVID, they should consider getting tested for COVID. But people who, thank God, are careful, they stay around in their house, they only go out when they have to, they don't socialize with other people without masks and distancing, they're very careful. I don't think routine COVID testing in that group, outside of a study, routine testing in that group is probably a negative, not a positive.
Thank you.
Does anybody else have a question? Nathan?
Yes. What was in what medications were the cocktails that the president got?
So the president took a little bit of a different cocktail, very similar to what Governor Christie took. President Trump took a different company's product. The one that is available now through this emergency use authorization that Governor Christie took was a product that's made by Lilly. That's the Bamlanivimab. The product that President Trump took was a very similar product made by a company called Regeneron. And that is not yet FDA emergency use authorized, although they've submitted their data. And the hope is that they'll also get that emergency use authorization. And then we'll have even another, piece of equipment that we can handle and take care of patients who get COVID. So I think these are very exciting new treatments, but they're not yet widely available, and one is not available at all, unless you're president. If you're president, it's available.
Yeah.
So elect me president.
Right.
Anybody else? Question?
Yeah.
Norman?
The vaccine put out by Moderna and the other vaccines that may be coming out soon, do you know whether or not they're going to need 2 inoculations or just 1?
A very good question. So both of the first 2 that will be probably coming out, the Pfizer one as well as the Moderna one, require 2. I put up 3, but I meant 2 doses of vaccine. So you'll take it 1 at time 0 whenever you take it. And then about 3 weeks later, if you take it a little bit more than 3 weeks, it won't ruin it. But at about 3 weeks later, you take the second dose. Everybody over here asks me, will 1 dose be somewhat effective? And the answer is probably yes. But the studies have looked at 2 doses. So therefore, that's what we're recommending for those vaccines, 2 doses. Now, some of the other vaccines will only be a single dose of the vaccine. When you take a flu shot, you only take 1 shot each year, and that's usually fine. So some of the vaccines will only require, I know the Johnson & Johnson vaccine product will only require a single dose, but that's not yet here. And I would tell people, if there's a 2-dose vaccine that's available, run to take it. Don't wait for the 1-dose vaccine to come out. If there's a good 2-dose vaccine available, I wouldn't worry about the extra little prick in your arm. It could save your life. Don't think twice. I wouldn't wait. Now, if they were all equal, sure, why not take 1 dose? So
Just
we'll have to
follow
wait.
up, if I may. If you take the second dose, let's say 4 weeks later, or 4.5 weeks later, is it still effective?
It should be.
We went through this with the shingles vaccine,
Right.
and you couldn't get the second shot.
Right, I know. So with the shingles vaccine, you have a much longer period. With the Shingrix, the new shingles vaccine, it's 3 or 4 years out already. So with the new Shingrix vaccine, you're supposed to take it between 2 and 6 months, the second dose afterwards. But if you take it at 7 months, you'll still get a lot of protection from it. So these aren't hard and fast rules. If you take it day 22 instead of day 21, nothing will happen. You'll be just as protected. And if you take this one at 4 weeks, you'll be just as protected. Sometimes they pick these numbers out of a hat. And they said, well, let's do it at 21 days. And it worked. So they stick to 21 days. If somebody was going on a submarine and wouldn't be able to get the vaccine and it was day 20, I would tell them, take the vaccine on day 20. Don't wait 6 months till you come back off the nuclear submarine to get your second dose. So some of these things aren't written in stone. We make guidelines, and guidelines are that, guidelines. So I would tell you 3 weeks, 21 days is the recommended second dose. If you take it a little bit after that, it'll be fine. Don't get caught up in that. That should be fine.
I have one more follow-up to that. If we are able to get the dose here while we're in New York and then happen to go to Florida, which is a possibility, what are the chances that we can get the vaccine in time in another state?
So I don't know the answer to that. It's also a very good question. My guess is that all the states will have some distribution system of vaccines. And I guess as long as you can document that you had the first dose, the provider in that other place will hopefully be able to provide you with the second dose. It's probably something worthwhile to check out. It would be a shame to leave on day 20 and not get the second dose if the place you're going to doesn't have the second dose. So it's probably not going to affect too many people, even in the situation that you're saying. I don't know when the first dose will be available to the general public. The first dose will not be available to the general public in December. I think if it is available, it'll be probably rolled out to healthcare workers. A little bit, we're going to be guinea pigs, which we're fine with, at least I am. And then when they hopefully see that there are no problems or complications in vaccinating a whole bunch of doctors and nurses, so then they can say in maybe January or February, hey, it's now safe to give it to older people, to give it to people in other high-risk groups. So I would tell you, if you're planning on going down to Florida in December, I don't think that question will take off for you. I don't think you'll have an opportunity to get the first dose here and the second dose in Florida, but maybe you'll be able to get 2 doses in Florida, maybe in January or in February.
Thank you.
If you invite me down, to Florida, maybe I'll even give you the second dose.
There you go. Sylvia, you had a question?
Yes, I want to know, is the COVID shot once a year like the flu shot, or is it lifetime
No.
like shingles?
So
They don't-
you're all asking very good questions that I don't know the answer to. So I'm a little bit embarrassed. I keep on saying I don't know the answer. So we don't have experience yet with the COVID vaccine. So we have no idea if people who get COVID now can really get it a second time. There are very few people that have gotten it a second time, but most people have not. Will I be saying the same thing a year from now, 2 years from now? I don't know. So we certainly don't know if the vaccine will be good 2 years from now or even 3 months from now. What we're all hoping for is let's get out of this pandemic as bad as it is right now, and the vaccine will certainly help. And then we can worry about, gee, I have to take it every year like the flu shot. That should be our biggest problem.
You're right.
That should be our biggest problem.
All right, I'd like to know if the vaccine, you take the first dose and you go to take the second dose, is it the same dosage or is it stronger or less?
It's a good question also. It's the same exact vaccine, you just get it a second time. There's no different doses of the vaccine. Just give me 1 second, please. I'm on a call. I'll call you right back. Sorry about that. So I do have to go and take that. But if there are no more questions, then it's been my honor and pleasure to be here. Thank the JCC of Oceanside, which I have grandchildren in that wonderful
Thank you.
program that you have there. And it's a great JCC. And I thank you all for listening, and I hope I've answered your questions. And again, I thank Val from Mount Sinai South NASA for setting this up. And I thank you all for listening.
Thank you.
Thank you so much, Dr. Glatt.
Lisa, I have a question for you.
Sure.
So I'm going to get off then. Thank you very much, everybody.
Thank you, Dr. Glatt.
Bye-bye.
Lisa, I tried to sign up for